In this video, we are going to see the step-by-step instrumentation sequence for standard canals.
Let's present the standard cases technique sequence. In this video segment, we're going to discuss the Genius Proflex instrumentation technique focusing on standard anatomies canals, like mesial canals of lower molars, upper premolars, and buccal canals of upper molars. To demonstrate the Genius Proflex instrumentation sequence, it was developed a training block printed on a high-definition 3D printer. After a laborious job of detecting the mandibular molar morphology through micro-CT and transferring it to a CAD/CAM model, we were able to reproduce in one clear block the three most frequent types of root canal morphologies. The technique will be demonstrated with Medidenta's Genius Proflex instruments. These files are composed of a USA Fort Wayne's nickel titanium alloy, with both rhomboid triangular cross-section, or double S cross-section. Depending on the file, the customized heat-treated nickel titanium alloy can be predominantly on the austenitic phase, on a perfect balance between austenitic and martensitic, or more on the martensitic phase. The Genius Proflex recommendations for speed and torque vary according to the file group. The instruments must be sterilized before use, and it is recommended for single use only. The Genius Proflex Intro Pack is the right choice for standard canals anatomies. There are three instruments in the sequence: the curvature sweetener 2506, a 2504, and a 3504. Each one has a different heat treatment, customized for each file approach. The instrumentation sequence is in the technical guide inside the package. The masiolingual canal of the block represents the majority of standard curve canals anatomy. It has a mild curve from mesial to distal, and equally a slight curve from buccal to lingual. Before starting the instrumentation sequence itself, some important procedures must be highlighted. It is always good to remember that rubber dam absolute isolation is mandatory in endodontics. First, we will clean the pulp chamber and prepare the canal's entrance using the Sonus E17 conical-shaped ultrasonic tip, with constant irrigation, gently touching the access preparation sidewalls. With the pulp chamber clean and the canal entrances prepared, we're going to add a lubricant that contains hydrogen peroxide to facilitate the canal's scouting and help with disinfection. Then we pour sodium hypochlorite to start cleaning, disinfecting, and removing organic tissue from the cervical and middle thirds. Note the champagne effect of the chemical reaction between the RC prime lubricant and sodium hypochlorite. We will start instrumentation using a number 10 stainless steel K file to scout the canal by inserting the instrument freely in an up and down movement, up to the temporary working length. Proceed with the 2506 curvature sweetener file, up to the middle of the curvature, or until finding resistance. Customized gold heat treatment and 19 mm length give this instrument the ability to partially enlarge the curvature entrance, leaving the area free of interferences to the next instrument in sequence. Copious irrigation must always be performed after 10 seconds of file usage. With the pulp chamber full of irrigating solution, determine the working length using a number 15 K file and an apex locator. Place the instrument inside the canal and advance to the temporary working length. With the instrument in position, install the file connector and gently advance apically with oscillatory movements until the apex locator points to position 0. Remove the file connector and proceed with a smooth enlargement with the file in position using short oscillatory movements. The next instrument in the sequence is the Genius Proflex 2504. This file can be used in rotation or even reciprocation with Genius motor or the new ACE cordless endodontic motor. Do not force or use pecking movements. If resistance is encountered, pull back the instrument until you release it and proceed with brushing movements. Do not remain more than 10 seconds with the instrument active inside the canal. Copious irrigation and patency with the K-File 15 should always be performed after 10 seconds of file usage. Finish the preparation with the Genius Proflex 3504. This apical final enlargement diameter results, according to studies, in a more efficient cleaning, increasing the space for the irrigation action and a better obturation adaptation. Finalize your preparation with copious irrigation, preferably using the polysonic tip and the Sonus piezoelectric ultrasonic unit. The Genius Proflex files promote the optimum space for the best fitting master gutta percha cone. Thanks for joining us in this presentation. For more videos and information, go to www.medidentaendo.com.